Now, well, we've enjoyed a lot, we've learned a lot. It is time to get to work. It is our job to prevent cancer, and well, I'm very happy to ask Professor Aranda to join us for this call to action. Please, Sanchia. Thank you.
Thank you very much. I hope you've all had a great day, and we're nearing the final parts. We are just 8 years away from the 2025 deadline, and for any of you who've watched children grow up, those 8 years will go very fast. We know that the next 5 years in particular will be critical, and commitments made in this last push towards 2025 will lay the foundation for the future. As a cancer community, we must ensure that 2018, marked by the UN High-Level Meeting on Non-Communicable Diseases, is a year of renewed commitment to tangible actions towards delivering the 2025 targets. We know that to have a real and lasting impact on reducing premature cancer mortality by 2025, there has to be a core investment focused on scaling up access to quality cancer treatment and care, and this is clearly articulated in the 2017 resolution, but often gets overshadowed by the commitment towards prevention. Today we have heard that an integrated, comprehensive cancer control strategy is the best alternative for a more balanced, efficient and equitable use of limited resources. In low and middle income countries with scarce human resources and limited infrastructure, a cancer control plan that considers primary, secondary and tertiary health care for cancer patients will have the best opportunity of moving into effective action and control of this disease. Today we've heard inspiring examples of how cities can take the lead in delivering sustainable solutions to improve access to cancer treatment and care, and can be key drivers in reaching the 2025 targets. We have also heard how cities must work hand in hand with national governments and the international community to make that happen. I ask all of you assembled today to bring the lessons you have learned and shared here today home to your own cities and employ your leaders and yourselves to do what you can to impact the 2025 targets by making a commitment to join the City Cancer Challenge. We recognise that every city is unique, with different needs, priorities, solutions, and each one, regardless of geography, income setting or structure, has the potential to share learnings and good practices with others, as we have done today. In joining the City Cancer Challenge, you are joining a new community of city stakeholders and leaders who, with the support from one another, from UICC, from our more than 1,000 members around the globe, from our partners, both the private sector and the UN agencies, all also represented here today, can take a lead in improving the health of their citizens. Beginning in 2018, our ambition is to gradually scale up support to a wide network of cities with populations greater than 1 million in every region of the world. The CCAN 2025 Challenge City Call for Action and call for applications launched this week provides more information about how your cities can get involved and the role your civil society organisation or your private sector company can play in the process. To ensure that we can provide each city with the appropriate support and guidance, UICC are committing to support 5 new challenge cities in 2018 and a further 5 in 2019. We have already heard interest from many of the cities represented here today, cities that can also inspire and support others so that together we can reach the 2025 goal. We want to see this as the beginning of a movement that will scale up over the coming years. And we now have an exciting announcement from CCAN 2025 in relation to our learning cities, and I'm honoured to invite Minister, the Honourable Kwaku Agyeman-Manu, the Minister of Health of Ghana, to join me on the stage to share this news. Welcome, Minister.
Her Royal Highness, Princess Dina, Excellencies, ladies and gentlemen, the past 2 days have been very insightful for me personally and members of my team from Ghana. In particular, I have come to appreciate the gains made in other parts of the world and putting them in the Ghanaian context. I must say I'm living here energized to support my technical staff in the teaching hospitals and the Ghana Health Service, together with the Regenerative Health and Nutrition Unit of the Ministry of Health, to take cancer control to greater heights in Ghana. As a country, we have made significant progress in cancer prevention and control, from the training of doctors locally to treat cancer, to the inclusion of some cancers in the benefits package of the much-touted National Health Insurance Scheme of Ghana. We can be said to be on the right trajectory. This is in no means a denial. There is no means a denial that there aren't challenges. We currently have 2 population-based cancer registries, which are at various stages of development, and we must hasten the process to ensure we have good quality data to guide decision-making. Non-communicable diseases, including cancer, are a rising challenge in Africa, and the government of Ghana is committed to tackling this problem. 51.9% of Ghana's population live in urban areas. By focusing on our cities, we have an opportunity to accelerate change for our people. I am proud to announce to the World Cancer Leaders Summit that Kumasi, the second largest city in our country, Ghana, will join the City Cancer Challenge. Thank you. You can stay there, but keep standing. I am joined today by an esteemed group of leaders and doctors from Ghana who will work together with UICC and all of CCAN 2025's global partners. And the team that I came with has how many oncologists? 2 of them, 1 from the private sector and a civil society activist. Then we have 1 in the second largest teaching hospital that is based in the city, Kumasi. Then I came with the regional minister where the city is located. And then we have the mayor of Kumasi and the CEO of the teaching hospital and the man in charge of non-communicable diseases in the ministry and my personal assistant, Linda. We are seriously supported by our president to take this course. In fact, I wasn't going to come to Mexico. I had been scheduled to travel to do TB in Moscow. Then came a letter from the president that you should go and represent me in Mexico. And that is how close the president is to the activity that we're undertaking today. As the first CCAN 2025 city in Africa, Kumasi is committed to leading by example and improving cancer care and treatment for the people of Ghana. The current government in Ghana captured policy on cancer as one of its main targets for the health sector. The policy will seek to expand access to screening and care for cancers in Ghana from the very basic level of the health system to the tertiary level. Government has therefore no option to deliver on this campaign promise. I'm therefore going away with my other colleague, ministers, and the technical team that I came with. As the Ghana team, to ensure that we meet the 2025 target of reducing morbidity by 25%. I wish all of you the best of luck in our endeavors. I thank you so much.
And I'm sure our colleagues from Ghana and Kumasi will now start the journey that Kali, Asuncion and Yangon have already started, and it's a lot of work, but I'm sure the rewards will be worth it. In moving into our final part of today, I would just like to acknowledge all of our partners and sponsors for this summit today, from the UN agencies that you see listed here to the various private sector sponsors on the back wall. Without your support, we couldn't put on an event like this. But I think also importantly, we are, as an organisation and through our partners and sponsors, living out a commitment to multi-sectorial approaches to improving cancer and NCD outcomes throughout the world. So please join me in supporting our partners and sponsors. I also want to pay particular tribute to our hosts, the Federal Government of Mexico, the Ministry of Health of Mexico and the National Cancer Institute of Mexico, who've provided extraordinary hospitality, from blocking streets to turning monuments orange to providing just the most fantastic support. So if I could ask Dr. Meneses to the stage to accept a small token of our appreciation. Muchas gracias, amigo.